morning. I'm Michelle Levander, Director of the Center for Health Journalism. Thanks for joining us today for our Health Matters webinar, Outgunned, America's Public Health Crisis, offered thanks to a generous grant from the National Institute of Healthcare Management Foundation. At a time when the nation's attention is focused on the tragic school shooting in Florida, we'll take a look at what we know about gun violence, not from the perspective of crime, but of public health. It's a fundamentally different framework for understanding these seemingly senseless and all too frequent events. The two experts who are speaking on this today are two of the most prominent researchers in this field. David Hemingway, PhD, is a professor of health policy at the Harvard T.H. Chan School of Public Health and the director of the Harvard Injury Control Research Center. Garen Wintemute, MD, MPH, is a professor of emergency medicine at the University of California, Davis, and the director of the University of California Violence Prevention Research Program, a center he helped fund with $1 million of his own money because the Centers for Disease Control would not fund this research. We'll also hear from journalist Lois Beckett, a senior reporter for The Guardian, who covers gun policy, criminal justice, and the far right in the United States. She'll share her insights from years covering these issues, illuminating some of the ways that media misses uncovered aspects of the story of gun violence, particularly the racial disparities and who's affected by violence, and which stories get the most national attention. Before we get started, I want to share a few operating procedures. We'll hear first from all our speakers, then we'll open it up to your questions for the final 20 minutes. Because we have several hundred people participating in the webinar, we'll ask you to comment in the question field in your control panel, and we'll read your question. If you have technical challenges, please also text us through the question or comment field in your control panel. You can tweet about this webinar at the hashtag #GunViolence. So why don't we get underway? Garen, why don't you get us started? If America has a gun violence epidemic, who are its victims? Is the face of this epidemic the young people of Marjory Stoneman Douglas High School in Parkland, Florida?
Talk to me, see if that works.
Garen?
I'm sorry, we're just having a hard time getting to screen show. There we are. And hello, everybody. Hold on to your, I'm sorry, technical point. May I ask, is everyone else also seeing the little control panel or just us?
We're just seeing you. You're perfect.
Great. Okay. Thank you. Hi, everybody. I'm going to be the setup guy today. I'm going to ask you to hold on to your hats. We're going to move pretty quickly and cover a lot of ground. It used to be a hard case to make that violence and firearm violence in particular were public health problems. Crime was seen as something for law enforcement to deal with. Suicide was a mental health problem if we talked about it at all. And accidents as they were known were uncommon, and those were for safety professionals. The best articulation of that point of view that I've ever seen came from, sorry, our slides are not advancing. Give us 1 second. There we go. Came from David Satcher, a physician who had just become head of CDC, who told the New York Times in 1993 what you can see on your slide. I think it's a very simple statement of the obvious that for many people 20 years ago helped reframe the issue. I know that we are here because firearm violence that doesn't make the news. So let's talk some about David Satcher's All Those People. I'm not going to read these numbers. You can see them, and incidentally, these slides will be available. I will, as you're scanning the numbers on these slides, make this point. In the most recent 10 years for which we have data, or any recent 10-year period you care to mention, we have lost more civilians in the United States to firearm violence, suicide or homicide, than we had combat fatalities in World War II. That ranks this as a significant problem. The following slides are going to make some comparisons, some of which are old hat to this audience, but others of which might be a little bit less familiar. Comparisons are really helpful in epidemiology, which is the discipline I work in, and in public health and biomedicine generally. You're seeing here the contrast in how the nation has dealt with two major health and social problems, both of which happen to involve physical injury. The top line shows you what we did with motor vehicles. In the late 1950s, early 1960s, we were experiencing an epidemic. We did something that this country does really well and is proud of. We mobilized. We put smart people on the case. We gave them money to study the problem, understand it, make recommendations. Policymakers were waiting in the wings to put those recommendations into action, and the downward slope as we go forward in time is the outcome. With firearm violence, we have consciously and repeatedly taken the opposite tack. I'm not going to go into the details. Many of you have reported on them as recently as this morning, the result of which being that we have essentially as many deaths from firearm violence in the United States as we do from motor vehicle injury. It's less well known that a majority of fatal firearm violence in the United States is suicide. We tend not to think about suicide so much until just the last couple of years when homicide rates have started to increase. Note that for almost a decade, we had a gradual decline in rates of firearm homicide while rates of firearm suicide were steadily going upward. We're going to drill down into each of these in just a moment. But it's been true not just in the late 80s and early 90s, as you see toward the left of the slide, but throughout the 20th century, from the beginning of the compilation of high-quality death registration data in the United States, that we've had more firearm suicides than homicides, generally by a margin of at least 50%. This is a graph that you're familiar with, even if you've never seen it. We're looking here at firearm homicide rates among males by race ethnicity for 2016, which is the most recent year for which we have data. This slide shows the truly remarkable concentration of risk for firearm homicide among young men of color, quite specifically young African American men. For the sake of time, I've left out the slide that shows the time trend. Horrific as these numbers are, this is a substantial improvement. 20 years ago, the firearm homicide rate for young black men was well in excess of 150 at a time when as holding some promise for prevention efforts. If the high-risk population is small, all other things being equal, interventions can be concentrated. We have learned, we continue to learn, that that's not been the case here. We might explore that some during question and answer. Let me show you a graph now that's less familiar, I suspect. This is mortality from firearm suicide. Recall that it's more common. What we see here are two differences from the slide I just showed you. First off, rates go up with age, and then at least for white non-Hispanic, they continue to go up. They don't go down with age. For African Americans and Hispanics, they decrease slightly or level off and then increase right at the end of life. But here, what we see is really a reversal of the pattern that we saw for suicide. I've again left some slides out that will be available to you. When we look at not rates but number, when we look at the burden of illness, if you will, from firearm violence in the United States, the findings for white non-Hispanic older men become even more prominent simply because that's a much larger group. So in the longer version of this talk, I sometimes conclude this part by saying, who knew that firearm violence was really so much an old white guy problem? This is going to be my last slide, but I'm going to spend some time here and hope that this will stimulate some discussion. I want to focus on some interventions that have been relatively robustly shown to work or certainly have promise. One is background checks for firearm purchases. There's little question but that denying the purchase of a firearm to someone who's at high risk for misusing it has benefits. We have shown that risk for subsequent violence is reduced by about 30% when that happens. But it's also become clear from work that we and others have done looking at background checks at the population level, not the individual level, that there's room for improvement. First off, as we've learned from a number of mass shootings, Charlottesville and Sutherland Springs come to mind, background checks are only as good as the data they're run on. If agencies don't report, then those prohibiting events are not available for background checks. We've had at least 2 mass shooters that I can recall off the top of my head who purchased firearms having passed a background check that should have stopped them. And it's worth pointing out that reporting of prohibiting information for background check purposes is voluntary, except for federal agencies. Only federal agencies are required. State and local law enforcement agencies do it if they want to. Incentives have been created, but there remain significant gaps in the data. It's also clear that compliance is incomplete. It's clear that enforcement is incomplete. In some cases, it's clear that the definitions of the prohibiting events are ambiguous enough that a person of good faith can have a very difficult time figuring out if a particular event involving a particular person should prohibit them or not. So there's room for improvement. And we have studies coming out over the next few months that will flesh this out. It is at least promising, and the available data are consistently in favor of the next intervention on the list. It's at least promising that expanding denial criteria of violent criminal convictions as long as my arm. But if those convictions are not felonies, do not involve domestic violence, I can buy all the guns I want, except in states that have taken a step beyond federal law to prohibit people convicted of misdemeanor violent crimes from purchasing firearms. Alcohol abuse is an area we are very actively exploring. I will say this, among people who legally purchase firearms, those with a documented history of alcohol abuse, let's say through convictions for driving under the influence, are at approximately 4-fold increase in risk for future violence after other factors are controlled for. We are doing some additional research here, expect that the policy implications may be fairly clear. I'm going to spend a moment on gun violence restraining orders because there's so much in the news. California has this policy, our group is evaluating it. Had a gun violence restraining order been available and used in Florida, the Parkland shooting could have been prevented. These are modeled, at least in California, on our domestic violence restraining order policy. They allow family members or members of law enforcement to go to a judge and make a case, which must be evaluated following specified rules of evidence, to say, in essence, Your Honor, there's a real problem here. Risk of violence is high and imminent, and guns are part of the equation. The judge can issue an order requiring the person subject to it to provide those firearms to law enforcement for safekeeping. Those orders are typically served by law enforcement for obvious reasons. They come with search warrants if necessary. I know for a fact that gun violence restraining orders have been used in California to intervene and prevent mass shootings, to intervene and prevent terrorist shootings. And I'll mention here in California, we have a 10-day waiting period. So the 2 cases I had in mind when I mentioned mass and terrorist shootings were cases in which the individual had made credible threats but did not have firearms, had purchased them, but given the 10-day waiting period, the order was obtained and served during that time, and the purchase never occurred, and those threatened events did not occur either. And finally, I'll mention something more broadly. Recovering firearms from prohibited persons generally makes intuitive sense. We spend a lot of time preventing people who are prohibited from purchasing firearms. Shouldn't we take them back from people who bought them legally but have just recently become prohibited, usually for an event that signifies increase in risk in the short term, such as a conviction for a violent crime? California has such a program. It's operating statewide. We are evaluating it. We don't have outcome information, which is what we're looking for. Does it reduce risk of arrest? But I can tell you that this program, it's called the APPS program for Armed and Prohibited Persons System. It's been in the news a bunch just in the last few weeks, has intervened with tens of thousands of prohibited people, recovered tens of thousands of firearms, and nobody's been hurt. I will stop there.
Thank you. And now we're going to turn to Professor Hemingway. Can you tell us, how are guns a public health issue and not just a crime story? And does seeing this as a public health issue change the questions that you ask as a researcher?
Yes, thank you. Finding common ground, and then if we have time, mass shooting. Oh, and I promised my publisher, whether appropriate or not, to push this book. It summarizes the public health approach to private guns and public health, and it's only $25 at Amazon. So what's the public health approach? In one sentence, it is make it easy for people to stay healthy, make it difficult for them to become sick or injured. So if you don't want an obesity problem, make it really easy for people to get really healthy food and make it really easy to exercise. And we sort of do the opposite in the United States and are surprised when we have an obesity problem. The public health approach is really about harm reduction. It's about prevention. It's about going typically as far upstream as possible because that's the most effective way to prevent things rather than wait till the last second. It's about, as Garen mentioned, stepping back and trying to get everyone involved, thinking this is a serious societal problem. How can we get everyone in society to help rather than try to blame people, which often washes our hands of doing anything. It's shared responsibility. Let's get everyone working together. As Garen mentioned, one of the great success stories has been in motor vehicles. 50, 60 years ago, the focus was too much on just the driver. It was true, though, if drivers never made mistakes, if drivers never disobeyed the law, we have almost no crashes and almost no fatalities. So people have said, oh, education and enforcement was the mantra, and that's interestingly the mantra of the gun lobby today. Public health physicians changed this question from who caused the crash to what caused the injury. And it's clear people were being speared by steering wheels which didn't collapse. Their faces were being lacerated by windshields which weren't made of safety glass. And over time, we made cars so much safer. We made the roads so much safer. And the punchline is, 60 years later, nobody thinks drivers are any better today. We're a little better about drunk driving. We're a lot worse about distracted driving. And fatalities per mile driven have fallen 85 to 90%, a big success story. What were the key insights? One was, let's create a system where it's hard to make mistakes, hard to behave inappropriately. And still, if some people do, let's make sure no one's seriously injured. What does that mean, not make mistakes? You're riding on the California freeway. You're so tired, you're about to go to sleep. You start weaving. You're going to crash into another car, and suddenly, bop, 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 you hit these bot dots which say, wake up, stupid. You get back in line, and nobody is hurt. One of the key insights, too, in all the success stories is the importance of good data and research. So I wrote this other book about 64 documented successes in injury and violence prevention. We have them in all these other areas, but not in the firearms area in the United States as yet. And why is that? One reason is we don't have good data and research. You know this about the CDC. You know this about the NIH and overall funding for firearms research. And reporters always ask me, oh, what are the 2 or 3 things we need more research on? And the answer is everything. If we're going to have lots of guns, we have to learn to live with them. Last year, we wrote, I believe, the first review journal article focusing on what's actually being taught in gun training. As far as I know, no one's ever written a journal article about what's the effect of open gun carrying, and on and on and on and on. Why is data and research so important? As my statistics professor used to say, yes, it's easy to lie with statistics, but it's a lot easier to lie without statistics. Let me give an example, just focus on one small area, unintentional firearm deaths to children. We have a pretty good data system now for the National Violent Death Reporting System, though it's not in all states. But without this, you have people just spreading falsehoods, John Lott over and over has said about 2/3 of accidental gun deaths to children are shots fired by adult males with criminal backgrounds. Now, if that was true, we ought to do something about adult males with criminal backgrounds, but he has no citation and he's completely wrong. What we find when we look at the actual data is that 1/3 of children who are dying is self-inflicted. 1/3 are other children shooters as the shooters. 1/3 are slightly older teenagers, and the rest are parents, and there's no evidence at all that they're criminals. The key thing about the evidence, too, is it suggests what can be done. Most of these young people are unintentionally shot, typically by a sibling, a brother, an older brother in particular, or a close friend. But interestingly, 2 to 4-year-olds have actually a relatively high rate of accidental firearm deaths, and they shoot themselves. Yes, we have to worry about children at friends' houses, but virtually no one at a friend's house is shot and killed before the age of 11, and it's only boys. So what does that mean for policy? Well, clearly we should have child-proof guns. We have child-proof aspirin bottles, which save large numbers of lives. Wesson of Smith & Wesson fame actually created a fireproof gun, which to pull the trigger, you had to put a little pressure on the handle, which 2-year-olds couldn't do. And yes, we ought to have an ask campaign, but incredibly, I have an 8-year-old daughter. It's not as crucial for her as it is as if I had a 12-year-old son. And what we find is the most common circumstances of these unintentional firearm deaths is the kid finds his dad's semi-automatic. He takes out the magazine, he thinks it's unloaded, he pulls the trigger. So what could we do? We could blame the kids, we could blame the parents, or we could solve the problem, mandate that all semi-automatics, when you take out the magazine, it won't shoot. We've been doing lots of work on suicide prevention. If there's one thing we know, it's the relationship between guns and suicide. So, what explains the difference in suicide rates across cities in the United States, across states, across regions? The state difference in suicide is much greater than the state difference in heart disease or cancer or stroke. What explains the wide differences? Is it mental health? No, it's not. Is it suicide ideation? Is it suicide attempts? Incredibly no. What explains the great difference is guns. This just gives you a feeling here as you look at the high and the low gun states, and you divide it so you have about the same number of people in both. We're looking here at women. The study, you control for everything, but here it just gives you a feeling. In this most recent 10-year period, in the high gun states, over 5,000 women found guns and killed themselves compared to 708 in the low gun states. The non-gun suicide rate is gun in the home is an incredible risk factor for suicide. Everybody who studied this issue knows it. The suicide experts now know it. The gun researchers know it. Does having a gun in the home increase the risk of suicide? Of course. Who doesn't know it is the public. The public has no idea. And we've done surveys. The public thinks the gun doesn't matter. We've been working with gun organizations who are very safety oriented, trying to get them involved very successfully, I might add, in preventing firearm suicide, approaching them as the solution rather than the problem. And we've been working with gun shops, with gun trainers, trying to make sure that it becomes more of a social norm, just as friends don't let friends drive drunk. Similarly, if your friend is going through a bad patch, he's just got divorced, he's talking crazy, he's drinking, what you should do is you should, as a good friend, babysit his gun for a while, and then when he gets a new girlfriend and things are fine, he can get the gun back. And all these gun advocates will say, yes, this really makes sense because they all know someone who's died in a gun suicide. Finally, let me talk about mass shootings. There has been an increase in public mass shootings. This is a graph that just says the frequency in terms of the time between events. So the closer and closer the time period, the more often there's a mass shooting. In the 80s, there was once a year, and now in the 2000s, it's about 4 times a year. What about this notion of arming teachers? What are the potential benefits? What are the potential costs? Before we do anything like this, we should look at those. The benefits, you have to realize most of these benefits are supposed to be in some mass shooting when the students are cowering in the classroom and the brave teacher grabs their gun and is able to shoot. You should recognize that in the 21st century, there are about 100,000 K-8 schools in the United States, and I could only find 12 instances in which 2 or more students other than the perpetrator were killed. Just once about every 2 years. So if we arm 60,000 teachers, each one in any year would have not a like 1% chance of doing something good, or 1/10 of one chance, or 1/100th or 1/1000th of 1% of a chance of doing something. And then of course, it's anybody who's really studied this knows that their likelihood of really being able to do something unless they've been trained continuously at what to do in such an incredible situation, that they wouldn't be effective. Particularly if the perpetrator knows somebody's armed, will come in body armor. What are the costs? Every day, an armed teacher bring guns into school. These guns can get used inappropriately. We know at home where there's more guns, there's more danger. There's huge financial costs of all the training and so forth, and then all the educational costs of turning schools into armed fortresses. Thank you. Oh, and here's these wonderful books again.
Thank you, and especially thank you for referring us to those books, which look like worthwhile. All of you on this webinar. We're going to turn now to Lois. You've written about the tensions between data and evidence, about what it takes to prevent gun violence, and the way that
at what all of us are discussing and reporting on these past couple of weeks, which is this debate over how do we make American schools safe? Should we arm teachers? Do we need to fortify schools like embassies? What would that look like? It's worth noting that saying that we need to take a public health approach to gun violence is an idea that has a lot of popularity. Lots of members of the public will say, why don't we do this? We want to do this. It resonates. But I think there are tensions because a lot of what in practical terms it would mean to take a public health approach does mean doing very technical, very small interventions in our laws, in our policies. And I think that's one of the challenges that we all face in covering the gun debate, is that the emotions and the grief associated with this are so intense, and the solutions are, and these are the good solutions potentially, so technical and so hard to understand, very wonky. And so there's a real disjoint there in how do you explain the things that might actually work in a way that people will care about? Do people actually care about understanding what's actually necessary to do? And so that's a really big tension. So you've probably seen a map like this before, the map of the number of school shootings in America since the Sandy Hook shooting in 2012. And lots of different people will pick up this data from Every Town for Gun Safety, a gun control group, and they'll map it themselves. And you wrote and I wrote stories. How many school shootings had there been so far in 2018? Had it been 18? Had it been much less than that? Big fights over the definitions of how much schools are at risk or how many school shootings there have been. It's worth focusing on the fact that gun violence affecting American children is an enormous problem. So this analysis of publicly available CDC data in pediatrics in 2017 just looked at data that you and I can analyze it, but they did an in-depth analysis. And they found 1,300 children die from gunshot wounds every year. Nearly 6,000 more children are injured. And looking at 0 to 17, that's 700 gun homicides, 500 gun suicides, and 80 gun accidents. And that was something when I first came to this beat, I think that surprised me. I thought accidents would be a bigger part of the toll on American children, but that's not the case. These children and teenagers are more likely to be murdered than they are to be accidentally shot, even in a country with 300, 400 million guns. This just showing you again this study from pediatrics looking at firearm industries injuries has a lot of really helpful data, so you can just see the breakdown of these different numbers. But if you look more deeply into this pediatrics report, they'll actually say, okay, how many of these shootings of American children are happening in schools each year? And it turns out that we don't have very good data for looking at this. In fact, the National Violent Death Reporting System, which and the circumstances of shooting deaths, only at, when this study was done, had 17 states in it. And as Garen and David have pointed out, like, this isn't an accident. This program was underfunded. And in fact, the reason that this database now has 40 states in it is because after Sandy Hook, I want to know how many children are actually dying in schools. I want to know how, where we can help save children, where we should focus on. And we have, only a subset of 17 states. But in that subset, you can see really clearly that for younger children, 0% of them were being shot in school, 1% of the slightly older children, and that the place that children were most at risk of being shot, was in fact in their homes and neighborhoods. Just give me a second. Was in their homes and neighborhoods. So I think this is one of the real challenges of covering the gun debate. We're having a national conversation on how to make schools safe. We're having a national conversation on fortifying schools, and we are fortifying American schools while they are being shot at home. There's not national data on kids, but the National Center for Education Statistics does have data on all homicides of school-age children, and that actually backs up the similar trend that you saw in the small segment of 17 states. About 1% of the homicides are happening in schools, and this has been true, in fact, for decades. Here's the link to data from the National Center for Education Statistics going back to the 92-93 school year, and you can see that that American children are being murdered every day. Huge thousands of them are murdered each year, and yet only a tiny fraction of this is happening in school. Dewey Cornell, who's a researcher at the University of Virginia, is one of the nationally recognized experts on school safety, and he makes this point over and over again, and has been making it for years, that schools are actually safe in America. Even though we see these horrific incidents and we want to prevent them, if we're interested in saving the most children's lives, we wouldn't focus on schools, because children are more likely to be hurt in other places. Dr. Cornell is a great expert on this. He talks about it a lot, but he also talks about how difficult it is to make this point in America's gun debate, because many people, parents in particular, feel so intensely that they want their children to be safe at school. This is obvious. We all feel this. And yet, sometimes by fortifying schools, by putting police officers in schools, there's a real concern that emphasis on school safety leading up to Columbine, and certainly then spurred on even more by Columbine, actually led to more police officers in schools and led to more children of color being subjected to more discipline. And so what you got, the unintended consequences of trying to make schools safer, was in fact making a lot of children of color less safe, and advocates say fueling the school to prison pipeline. So we look at how we respond to violence and the strategies we do. They can have a real cost for kids. And again, this is from the pediatrics paper, but if you look at the circumstances of how kids are dying, especially young kids, you can see that in this subset of states, for kids 12 and under, about a third of them were being killed in circumstances of intimate partner violence. So that kids are not being killed overwhelmingly by masked intruders storming into their schools. They're being killed by the partner, their mothers, their fathers, or their mothers' boyfriends. That we worry about children being in danger at school, and yet it's actually the people who should be caring for them who are some of the most likely people to be killing them, to be putting them at risk. is data from the FBI, and Megan Hoyer at the Associated Press cleaned that and made it public. I have the link here. This data doesn't include children who are killed in intimate partner violence situations, but in covering this beat, it's always hard to get good data, and so this is something that is a real resource that I have used, and great to have that publicly available so that you don't have to reinvent the wheel and clean all this FBI data yourself. So this brings us to one of the questions that's really been discussed after the Parkland shooting, which is a lot of teenagers of color, especially Black teenagers and activists of color, Black Lives Matter activists, who have said, you know, we are so grateful to see teenagers standing up and getting attention and really pushing for political change. And it's great to get them, to see them getting so much support as well. But frustration in, you know, when, you know, kids at my school die, when I am standing up to protest, the journalists aren't showing up. The national conversation isn't happening for all students and all schools equally. And I think it's really important, as we're talking about a public health approach to gun violence, to recognize that those voices that we are hearing as part of this debate and that frustration reflects something really real when you look at the data overall, which is that there are stark racial, geographic, income disparities in who's most likely to be a victim of gun violence. Again, these statistics from the pediatrics paper, African-American kids have a homicide rate that is twice as high as the rate for Native American kids, 4 times higher than the rate for Hispanic kids, and 10 times higher than the rate for white and Asian American children. So if we're trying to say, if, you know, people will say, well, we want to take a public health approach to gun violence, and this is one of the many places where the data challenges the stories that we tell. And the evidence of who is being most hurt and who is most at risk is very different when you look at that data than when you look at the stories in the newspaper. Also really important to note, suicide is also a huge problem, and Native American and white children have the highest rates of firearm suicide. One story that I've never written, but that someone listening in, you might be in a place where that would be good. I haven't seen a lot of reporting on gun violence and Native American kids, especially the fact that they are at risk of both suicide and homicide. Seems like an important story, and you know, if you've written one of those stories, please send it to me. That's just an area where it seems like that is a story that's very important to tell. So just a little bit of background, this conversation that we're having now after Parkland with children in Philadelphia and Baltimore and Chicago saying this is so frustrating, this is so empowering to watch students become activists, and so strange to ask, you know, why more attention isn't given to the activism that we do, why more attention isn't given to the risks that we face. Is a long story. I wrote a story in 2015 looking back at a group of Black ministers who came to the Obama White House after the Sandy Hook shooting in early 2013 and asked the White House to do more to focus on children of color and young adults of color who are at risk. And the White House, you know, really didn't step up, in the opinion of some of those ministers, that they did put out a platform, as President Trump also put out a platform that was very much focused research on, if you're interested in preventing violence in communities of color in particular. Here is a report produced by the Law Center to Prevent Gun Violence, a great resource in collaboration with the PICO National Network, which is leading a campaign that's focused on criminal justice reform and gun violence prevention together. That's Mike McBride. And so they've put out this report. You can reach Live Free is the name of the campaign. They're still doing this work. Amber Goodwin, who worked at the Giffords campaign with Gabby Giffords in a campaign to do gun violence prevention, now leads the Community Justice Reform Coalition, which is an organization specifically focused on preventing gun violence in communities of color. And one of the resources that I think is tremendously helpful that Amber has put together is that she's developed a speakers bureau of a number of different Americans who have been affected by gun violence, who are working on gun violence, who come from communities that are most affected or who bring a different perspective. I know in the story stories that I've written and the stories many people write, it's really easy to do a story on the gun control debate and only quote white people and only quote white men. Especially whether you're talking about gun rights advocates, whether you're talking about gun violence prevention advocates or gun violence researchers. Gun violence researchers in particularly tend to be white men. So it's really easy to do that, but that of course is missing the bigger picture and not speaking to the experiences and what gun violence really looks like, not saying how do we really save people's lives and who do we need to bring into the conversation to do that effectively. So can really recommend the Speakers Bureau, a really interesting group of people. Amber Goodwin here is her contact information, so she's available and she's really part of a network of many different organizations that are working on gun violence prevention. The Black and Brown Gun Violence Prevention Coalition. So she is a great resource and also is connected to many people. So if you're looking for someone in your community who's also a national advocate who can speak to a different story, she's a great person to turn to. Here's an event that is happening focused on this issue. And just last, before we close up and go to questions, one other person I really think is a great person to follow on Twitter is Steve Gutowski, who is a conservative reporter on the gun beat at the Washington Free Beacon. And Stephen is a gun instructor and a gun owner himself, and he's written a lot very powerfully about the ways in which small technical errors that journalists sometimes make in reporting on guns are incredibly frustrating to gun owners. And he's actually put together a guide he just makes freely available, sort of pointing out some errors or just trying to offer some clarification if you're new to this beat or even if you're not new to this beat. I wouldn't say I agree with every terminological argument he makes in this, but he's a really helpful resource and a person with great integrity coming from a conservative perspective, but really fair-minded. And so another person, if you're trying to sort of deepen your reporting or just trying to think about how to make sure that a lot of different perspectives and all the different perspectives of this debate are making it into your reporting, Stephen is a really great person to turn to. I will now close up and we can shift to questions.
Thank you so much to all three of you. We're going to open it up now to questions. And you can all see in your control panel, there's a questions area, and you can type your question in, and we'll be reading those out to our speakers. Is to the literature and your 30% figure on risk for subsequent violence reduced with background check.
Yes. We published 2 articles in the Journal of the American Medical Association, and I can make them available through USC to all the attendees if you'd like. Both of them were done on people who legally purchased handguns here in California. We have an archive of those transactions. In the first study, we learned that among people who legally purchased firearms in California, those who at the time of purchase had multiple prior misdemeanor convictions, this study done on older data before we changed our law, those with multiple prior misdemeanor convictions were 15 times as likely as those with no arrest record, truly law-abiding gun owners, to be charged with serious violent crimes later, including homicide, aggravated assault, robbery, and rape. California later changed its law and prohibited such people from purchasing firearms. And we took advantage of that policy experiment, looking at 2 groups of people. Everybody in both groups tried to buy a gun. Everybody in both groups had at least 1 violent misdemeanor conviction. They were quite similar in other respects. The only difference was one group got their guns under the old policy, the second group did not under the new policy. And compared to the first group, the second group whose purchases were denied had a 25 to 30%, depending on the specifics, 25 to 30% decrease in risk for violent crimes involving firearms after adjusting for a lot of other stuff. And very importantly, there was no difference between the 2 groups in risk of arrest for other types of crimes. The observed effect was specific to the types of crimes the law was designed to prevent.
Karen, could you just emphasize too about what the data allow you to do in California that in most other states researchers would not be able to do?
I'm going to make this really brief. We have lots of data here in California that are not collected in other states, so we're able to do studies of large numbers of firearm owners. We also have a state that believes in the power of government to do good, and in that belief enacts novel policies. We are, I would argue, democracy's leading laboratory on this issue. The state collaborates actively with us in evaluating those policies to see if they work, to the extent that the state has established here a center to conduct such research.
Great, thank you. And we have a question from Claire Mitchell for each of you. What stories do you think go uncovered on this rich topic that you recommend reporters pursue?
So I'll lead since nobody else took over. The consequences of violence. I think just as we focus on mass shootings because they remain uncommon and they're horrific and we think they could affect us, unlike other forms of violence, we tend to focus on the acute event. And 2 weeks later, it's history. This is changing. We're starting to see more stories written about what it's like to be 1 month, 6 months, 1 year, 5 years, 20 years following exposure to firearm violence. But
crack at that?
I'd love to see more stories about the real aspects of supposed self-defense gun use.
And I'll just add in, there's a couple of stories that are playing out nationwide that I think are really interesting. Is that the National Sports Foundation, the trade industry for the, is partnering with the American Foundation for Suicide to do this sort of cultural change, suicide prevention work with gun owners at gun ranges nationwide. And so that's a partnership that was launched a year ago, and receives relatively little coverage to try to understand how is this working, and how are public health experts and mental and suicide prevention experts successfully working across mistrust and cultural divides with gun owners to find common ground and save people's lives. I think that's a really important one. And also, there are cities across America that have seen gun violence really go down. And sometimes that's brief and sometimes that's more long lasting. But we rarely see the stories of what does it take to save people's lives. At the local level, there's always headlines about when things go bad, but it's just or even more important to figure out what's going right when your city's seeing a decline in gun violence. And you can't just trust the police department or just trust the mayor to tell you that. It takes a lot more work, but I think those stories are so important because people have the idea that this never changes and that there's nothing that can be done, especially with urban violence. And that's not true. The stories just take a little bit deeper work.
And I would nominate the city of Los Angeles for such a story.
I would nominate. I think an interesting story is how California got to have the strongest gun laws in the United States.
So we have a question from Jonathan Perlow who says, when a state expands background checks to private sales, what type of analysis, study, research do you recommend to determine if the private sales are actually being subject to the background checks?
We're doing such work, and this is a really tough one. So here's one quick and easy thing. When expansion of background checks to private sales occurs, does the number of background checks go up? Seems like it ought to, and it turns out the results are equivocal. Does the number of background checks specific to private sales go up? Also not clear. Those data are available at NICS if anybody wants to look at them. We've done some structured work that some of which has appeared and more of which is coming. A completely different line of work, line of inquiry. Ask people, particularly since it's what's of interest, ask people who purchase firearms that are used in crime, did you go through a background check? Nobody's done that kind of work yet. We do know, and I'm sorry, thank you for the question because I forgot to bring it up in talking about background checks. We do know this. that in the United States, there are two parallel systems of gun commerce. One involves licensed retailers, a background check, a waiting period, permanent record. The other, which accounts for about 20% of all gun transfers in the United States, involves just two private parties. There's an exchange of cash for a gun. There's always a handshake. I've watched and photographed hundreds of these occurring over the years at gun shows. They're legal if state law allows and if the purchaser of the gun is not a prohibited person. But who this activity occurs underground, or it occurs in places where reporters, in my experience, have been reluctant to go historically, like gun shows. So it just occurs, but by definition, there are no data tracking the frequency of these events. That's the whole point from the buyer and seller's point of view.
We have a question from Tina Kartika. What do you think of the recently formed multi-state coalition to create a database for gun safety? Do you think it will be effective to prevent gun violence?
David, that one's yours.
Yeah, I don't know enough about it. I think anything that increases the amount of good data available is an incredibly important and useful thing. The issue about evaluations is too often people, for example, in the concealed carry debate, often only have aggregate data, and what you really need is disaggregate data to see if the laws really had their intended effect narrowly on the people who they were supposed to have an effect on.
We have a question from Aaron O'Toole, who wants to know, how can we get more data from states? It's clear that more research and funding for research will help with the gun violence issue, but with politics surrounding the issue, is this something that's possible in the foreseeable future? I guess it's sort of connected in a way to the prior question.
Yeah. Lois, what success have you had getting data from states?
What kind of data are we talking about?
Well, I'm assuming gun violence data, but yeah, that's all I have from the person.
Yeah, I mean, I think
it would be.
I mean, there's just so many fronts. Yeah.
Sorry.
Lois, why don't you go ahead?
Yeah, I mean, I think the short answer is there's a frustrating lack of data, but it's also a lot of the problem is that the data exists and it hasn't been cleaned. And so there is work that journalists can do. One of the resources that I shared is that a colleague of mine was able to use data from the Gun Violence Archive, which uses media reports to track every shooting or sort of interpersonal fatal shooting and non-fatal shooting in the United States. And using it, she was able to connect every gun homicide to a specific census tract. You can geographically map them and look at the ways that gun violence was clustered and sort of map where that was most serious, and found that actually about a quarter of America's gun homicides happen in about 1.5% of all census tracts. So there's this hugely disproportionate concentration, but in some ways gun violence is a lot smaller than we realize because it is so concentrated in neighborhoods that are already burdened with unemployment and with a lot of other divestment from local governments. So that's a long way of saying sometimes the data is there and no one has put the work and the hours into actually cleaning it and mapping it and making it for other people to use. And then in some cases, like the National Violent Death Reporting System, that we need more money, Congress to invest more money to close the loop there, to go from 40 states we have now to 50, because when we have all 50 states and start building that data, we're going to have a lot more specific information about the circumstances in which people are being killed, not just with guns. And that's going to give us a lot more power in trying to figure out how we can prevent that.
From Mia Aranya with Radio Lingua. First question is and equal numbers when it comes to suicide with firearms. And she also asked if the Speakers Bureau includes Spanish speakers.
So that might be coming to me, but Michelle, you were breaking up. I'm sorry.
Oh, yeah. The first question is there any research on why women are less likely to shoot people, and asking in particular about suicide with firearms? And then second question was for Lois, and that was asking about whether that bureau has Spanish speakers.
Oh, Lois, do you want to take the second part, and I can do the first, maybe?
I'm sorry, Michelle, I didn't quite hear you. Which data has Spanish speakers?
You talked about that speakers bureau, the speakers.
That's actually a good question. I'm not sure, but you can just click through the bios really quickly, and I think so.
And on the first part, I should have mentioned all the come from Whiskers, CDC's very cool interactive website. The data are widely believed to be highly accurate and as complete as can be. The downside is that Whiskers is pretty superficial. There will be more slides in what's available to you via the website, including the slides for women. I think I'm going to overgeneralize, but it's a good starting point. In general rates are 10 times higher for men than for women after controlling for race, ethnicity, and age, and so forth. But there are some interesting findings that show up. Homicide rates, excuse me, homicide rates are so much higher for African Americans than they are for whites, that the homicide rate for African American women, even though it's 10 times lower than the homicide rate for African American men for much of the lifespan, is still higher than the homicide rate for white males.
Let me just...
Go ahead, Professor Hemingway.
Yeah, this incredible data, and it gets every violent death, but there are problems with it. One is that it misses a lot, half the police shootings. It puts them as just regular homicides, and it misses a lot of the unintentional.
From Richard Maurer, who says, and maybe you can explain this, why do we not hear the words Dickey Amendment in this webinar?
Let's talk about the Dickey. So Jay Dickey, describing himself as the point man for the NRA, led an effort to defund firearm research at CDC. We had a program. We had to pretty much shut it down. But it was defunded, but there was never a de jure ban on research. Which people on this call, I suspect, know. There wasn't any funding for it at CDC. The National Institute of Justice had a program and just issued, by the way, advance notice that they will be issuing a solicitation for proposals specific to firearm violence and mass shootings this year. That just came out a week or two ago. And the NIH had a program for about 3 years. So I think it's important for y'all not to just focus on CDC. Do research here. Their perspectives are complementary. All three need to be involved. I will say Jay Dickey himself had a change of heart in his later years. He befriended Mark Rosenberg, the man at CDC whose job he largely made go away. He and Mark jointly wrote op-eds in the Washington Post and elsewhere saying we need firearm research. Just a personal anecdote, when our state legislature was considering a bill to create the Firearm Violence Research Center here, which they did do, there was a strong letter of support for that center from Jay Dickey. So when opposition legislators or witnesses would talk about what a terrible idea it was, the sponsor of the bill would sort of wave the letter in the air and say, you know, Jay Dickey of the Dickey Amendment disagrees with you, and that would kind of be the end of the conversation.
I think an interesting journal reporter's topic would be not only why the federal government is not funding, but where are the foundations in the United States? Why are not they funding gun research?
Well, with that, I'm afraid we've run out of time. I want to thank our three excellent presenters. I want to let our audience know that we will have the video of this webinar and all the slides and resources available on centerforhealthjournalism.org. And you'll be getting an email shortly with a short survey asking you for your feedback on this webinar and on future webinars. Thank you so much for joining us.
That's it.